Hi guys, Dr. G here with day 25 of Checkups with Dr. G, and today we are talking about anxiety. So, guys, that nervous feeling that you get, before an exam, before a job interview, before a wedding, before a speaking engagement or meeting somebody new, that feeling that you get that comes and goes, that is considered normal. However, if you are experiencing intense or extreme fear or worry that is persistent and it interrupts your day to day life for a period of 6 months or greater, then that is what we consider to be anxiety or an anxiety disorder. Now, there are many different forms of anxiety. There's generalized anxiety disorder, there are phobias, panic disorder, post traumatic stress disorder, social anxiety, health anxiety, and other forms of anxiety as well. So, depending on what your symptoms are and what your history is with anxiety, will determine like which one you would be diagnosed with. So, with anxiety, guys, there are, many different risk factors. A few of those include having experienced stressful or negative or traumatic events or life situations or environments, both as a child and or as an adult. Those can set you up to be at risk for anxiety. Having taken caffeine or other stimulating drugs or medication. There's things such as like cocaine or methamphetamines. Any of those things that are more stimulating are putting you at risk for anxiety disorders. Also, if you have a family history of anxiety disorders, or you have an underlying physical condition such as thyroid dysfunction, that can put you at risk for anxiety disorders. And again, guys, like I said, the anxiety disorders are going to be persistent and lasting for at least 6 months or greater. So the different anxiety disorders all have different symptoms. Some of them have similar symptoms, but they are going to have their key differences. Now, if you are experiencing generalized anxiety disorder, you may experience some things such as being easily fatigued. You may experience some muscle tension. You may also experience feeling wound up, difficulty concentrating, difficulty sleeping. You may feel like the feeling like I have to escape or get out of here type of thing. Panic disorders, you may begin to feel like numbness and tingling in your fingers. You may have the feeling of difficulty breathing, tightness in the chest. You might start feeling hot or cold in certain spots, like all over your body or in different places on your body. Phobias are going to be more so centered around specific thing. So it's when you get anxiousness or have that fear as it relates to specific things. I won't call out any specific things because I don't want to trigger anyone. Post traumatic stress disorder is going to be anxiety or nervousness surrounding a traumatic event, either one that you have personally experienced or one that you have witnessed. And even from having those close to you experience those disorders. Health anxiety is going to be more so related to health or health events. So that's going to be like you are more so anxious about your health. You might have like fear of dying, and that's also can be a part of a panic disorder, being having a fear of dying or impending doom. But health anxiety, you may have fear of dying. You may have a fear that you have a health disorder or fear of having a health disorder. You may experience symptoms and immediately you are associating it with some type of health disorder. So you want to be careful of that. Social anxiety is going to be more so when you are out and about and around other people. You start to experience feelings of anxiety, and so again, you may have some similar symptoms in each one, but each one also has their own specific things that we look out for when a patient is being evaluated or treated for anxiety. So, guys, tomorrow I will come back. I'll talk a little bit about some of the treatments and things that you can do to help with anxiety. I'll also share a little bit of my story in dealing with anxiety. And I look forward to helping you guys. I am very, very passionate about mental and emotional health, guys. So I really want you guys to pay attention and to look out for yourself and those around you when it comes to these things. So guys, if you have any questions, please feel free to drop your questions below on this video or any of my other videos. Feel free to send me a direct message on Twitter, Instagram, or Facebook at Whole You with G. You can email me at wholeyouwithg@gmail.com or drg at wholeyouwithdrg.com. And these videos will also be on YouTube. My YouTube channel is Whole You with Dr. G. I look forward to continuing the conversation tomorrow, and I hope you guys have an amazing night.